Hey guys, Dr. Sandal here, breaking the boundaries of mainstream medicine. Happy to have you all back. I get a lot of questions about what is functional medicine or integrative medicine or precision medicine or regenerative medicine. First of all, those are all essentially the same thing. There's maybe a little bit of variance in the practitioners and what they do, but really they're all talking about the same thing. They're talking about better medicine. They're talking about pushing the boundaries of medicine. They're talking about taking the things in mainstream medicine that don't work and innovating on them. We're talking about science here. There are chiropractors who practice this. There are naturopaths who practice this. There are MDs who practice this. Obviously, as you go up the chain in education, you're going to get a higher degree of scientific approach on this. I'm a little biased, but I think that MDs are naturally going to be really well positioned to do this well. That said, I've met naturopaths and chiropractors who just are excellent at this as well. I've also met some who are more hobbyists and like the idea, but can't give the product the same way because they don't have the scientific training. There's all sorts. Be picky, be skeptical. Ultimately, these things are all a scientific process that you can gauge and engage with and should engage with. Why does one think about this type of medicine? Well, you guys probably all know someone with a chronic illness. And chronic illness is often not well served in mainstream medicine, right? Take fibromyalgia as an example. So I had a patient who came into me and she had been through the absolute frickin' ringer. She'd seen her doctor, and for years her primary care doctor had tried to figure out what was going on with her. And eventually he throws up his hand and says, I don't know, it's fibromyalgia. Why don't you go see a specialist about it? This poor patient says, okay, doc, why don't we try that? And she goes and she sees a specialist, and the specialist says, hey, let's run all these tests on you. And they're all negative. And the doc's like, no, you're fine. You're fine, right? And so the patient experiences this type of gaslighting. They're like, no, I'm not fine. I hurt. I'm not feeling well. They're like, well, your tests look normal, so you must be fine. That's not just frustrating, it's nonsense, right? Terrible, terrible. And so the patient, they advocate for themselves and they say, doc, that's wrong. Send me to someone else. And they say, well, okay, why don't we send you to a different specialist? Let's say this person was a neurologist and they send them to a rheumatologist. They send them to a gastroenterologist. And eventually they come back around to a pain management specialist. It's a horrible story. And you guys probably all know someone with that story. And they get bounced around and nobody wants to take responsibility for their health and nobody can figure it out. Well, that's what we're here for. We're here to help you guys take responsibility for your own health, be your partners, your team members on this, and help you figure out how to frickin' heal. How do we figure out what was missing? Why did mainstream medicine not serve you? Where did it go wrong? That's why I talk about pushing the boundaries. That's why I talk about breaking the boundaries of mainstream medicine, because we need to do better. We have to. There are tons of patients who realize that mainstream medicine is completely failing them, right? So what happens? So this patient comes to me and they say, doc, I'm totally miserable. I've been through the ringer. I talked to a friend. He told me there's a different type of medicine. So what do? Well, the first thing we do is we treat them like an individual. We treat them like a person. We don't treat them like someone on an assembly line. We don't go to our little algorithm and say, oh, what medicine solves this problem? Oh, you don't fit in my box. See you later. Good luck. No, we talk to them. We play detective. And at the heart of this type of medicine, whether you want to call it functional or integrative, what we're doing is we're breaking very complicated problems down into multi-variable issues. We're saying, okay, yes, you have fibromyalgia, but if we think about that as just a single thing, it's not a very serviceable diagnosis. Instead, we look at that and we say, okay, you have these symptoms, manifest as chronic pain in your muscles, myalgia. Why do you have that? What are the multiple things that feed into that? What is wrong with your system that is manifest in this syndrome? And when we start to break that down, and remember, we do that after discussion, bespoke to the individual, everyone's got different causes for these things. There is not a one-size-fits-all in fibromyalgia. There's not a one-size-fits-all in human health. Even something as relatively simple as high blood pressure. There are multiple causes for that. You might not have heard that before from a mainstream doctor, but there are. And those are root causes. And if you attack those root causes, if you bring the body back into harmony and say, okay, this person has fibromyalgia, this went wrong, this went wrong, this went wrong, this went wrong, this is out of balance, they're missing this. You correct those things, and I will tell you, all the time we see those syndromes reverse. We see those symptoms improve. I really want to challenge the other MDs out there. We can do better. It's just complicated. It's intellectual labor. It doesn't fit well into the insurance-based system. It's true, I know. But it doesn't mean we shouldn't be pushing ourselves. We should be doing this for our patients. That poor patient who got punted around for 3 years and ultimately stuck on pain medicines is now off pain medicines, no longer has any chronic pain, and that diagnosis doesn't fit that poor lady anymore. She's vibrant, she's exercising, she's having a blast. We can do better, and we have to. This is an absolute necessity. So, guys, make sure you subscribe. We're going to talk more about breaking the boundaries of mainstream medicine. We're going to do better. Let's push forward the system. Let's get our patients some results. If you're a patient out there listening to this, know that you should be engaged with your healthcare. In fact, we're going to talk about that more in our next video. See you there.